Good evening, everybody. Hello, Osiris. Welcome. This
Hi,
is
Maria.
an episode of Gynecology on a kind of muggy Thursday night in Princeton, New Jersey. I'm joined by Osiris, who will tell you where she is, not quite in Princeton, New Jersey. I wish she was. And tonight we're going to talk a little bit about healthcare advocacy, really, for the LGBTQ community. It's Pride Month. I'm so glad it's a whole month now. So Pride there can be Pride discussion and LGBTQ discussion, and more than just parades and fun times. I think it's important internationally and nationally that we give time, energy, effort to maintaining and advancing rights for the LGBTQ community, which for so long has been marginalized. My guest tonight is Osiris, who's an Associate General Counsel for Blue Cross Blue Shield of Massachusetts. She has quite an amazing bio. From 2003 to 2009, she was the president of a nonprofit called Respond, which focused on providing shelter and counseling services to women and children who were victims of domestic abuse. This is another marginalized group that just goes way, way, way under the radar. And it takes really committed, dedicated people like Io to do more than just feel sad for them, to really go out and raise money and make sure things happen for them. She was the executive director of the Coastal AIDS Network. This was assisting individuals with AIDS across 3 counties in Maine. Maine is her second home, I guess you'd say,
Right,
and where Io grew up. And so she has a special spot in her heart, I know, for Maine. And also she does for HIV positive and AIDS people. She also worked at GMHC, which was based in Manhattan. GMHC offers HIV prevention, education, and outreach, and works to raise awareness and engages in treatment advocacy. And I think she was in the Women's Education Service division of that. I'd love you to tell us a little bit more about those things. But before you do, I want to just brag about her a tiny bit more. Osiris co-founded something called the Pat Parker Award, which I had never heard of, and maybe some of you haven't heard of either. It's organized and given by the National Organization of Black Lesbians on Aging, and it's an honor which celebrates the achievement of Pat Parker. I'm going to let Io tell us a little bit about Pat Parker and who she was, because I'll bet she has a kind of neat story, and obviously worthwhile if she's got this award named after her. Io, you're also affiliated with and have spent time and energy and devoted so much of yourself to numerous other charities. But I'd love you to tell us a little bit about, either something particularly moving for you in all your years of service, community service, and certainly you have to tell us about Pat Parker a little bit too, and then we'll get started on what we're here to talk about.
Sure. Thank you, Maria. Happy Pride Month. I'm very excited to be here. It's been a long couple years of isolation, and we've been deprived of gatherings and Pride activities, and so it's really nice to be here and just be able to acknowledge what an important month this is. As you can tell, there's kind of a theme to some of my work, and I'll start by talking a little bit about GMHC Gay Men's Health Crisis, because there I was coordinating women's HIV prevention programs, working with the most at-risk women, typically in 7 or so of the New York City communities with the highest rates of HIV seroprevalence. And so those happen to be, at the time, HIV/AIDS was thought of as a white gay man's disease.
Right.
And similar to COVID, HIV, like COVID, really exposed the fissures in our society, the lines in our society between people of color and white people, people with money, people with less money, women and men, gay, trans, straight. HIV and AIDS tended to really impact and affect most people who had the least resources.
Was
and
this
so
because they didn't have access to getting tested, or because they didn't have access to treatment, or both?
for lots of reasons. So the lack of access to treatment is one issue. At the time, especially HIV/AIDS treatments under clinical trial rules through the National Institutes of Health and others, women were excluded from trials for HIV treatments. For a lot of reasons. Historically, people of color historically have not had access to those clinical trials. So treatments for HIV were largely, almost exclusively being tested on white men. So that's something that some activist and advocacy groups worked on, like ACT UP. Meeting with Tony Fauci, both inside the system and outside the system, taking to the streets and trying to open up clinical trials, talking directly to pharmaceutical companies to try to be more inclusive and include people of color, women of color in clinical trials. So that's one issue. Another issue is, for a lot of people who were most at risk or at risk of HIV, and the women that I was working with lived in communities, had been raised in communities with multiple public health epidemics going on. So high rates of incarceration, high rates of asthma, high rates of domestic violence, high rates of crime, mostly under-resourced communities. So where people did not have, good access to healthcare, good access to education, understanding at the time. This was the early 90s. So even just understanding drug use was really one of the biggest issues at the time, injection drug use and safe.
I know you're not, are you still with GMHC, or you?
Right. No, that was a long time ago. That's in my way distant past.
Yeah.
But, when
you
you
have
talk
a sense for how that crowd and that problem has evolved, have we made improvements in getting minority women involved in studies, or are they not any longer disproportionately seropositive?
Yes. So I believe the rules for clinical trials have changed. Now, the rules were in place and sometimes for good reasons, right? If you're using experimental treatment for HIV that could harm a fetus, for example, you may have good reasons for saying that you don't want to include women of childbearing age because, if a woman should get pregnant during the trial, et cetera. But the point being, those rules have changed. And Tony Fauci will be the first to tell you or to talk about the fact that his work with ACT UP really, and the NIH's work really, caused some good changes. As you know, too, protease inhibitors did come out in the mid-90s, and those were game changing. Now, I think there are some people who feel like, can you believe we still don't have a vaccine for HIV? It is a virus after all these years. And there are people, who feel that part of that is because the resources just have not been applied to it. People can say that may be for different reasons. Maybe that's just too small of a population or too marginalized of a population. So there's no profit motive.
Or with protease inhibitors, people are living longer and they're sort of almost off the radar screen. I mean,
very off the radar.
My HIV positive patients are healthy as can be, and many of them have been HIV positive for 30 years. And I wish there was a vaccine. I would love that. But it's almost come out of the spotlight. Certainly it's bumped off now by COVID. COVID has actually put a lot of research on hold for other things because it's sort of became the holy grail, right, to get a vaccine for COVID.
So let's just go ahead and say HIV is still out there. Safer sex is important. We're for straight people, for gay people. Let's remember too, it's not just a gay person's disease. HIV, like COVID, knows no gender, knows no race, knows no sexual orientation.
And also PrEP. I think let's make a quick shout out to PrEP so people kind of know what that is. Pre-exposure prophylaxis, PrEP. I mean, the short is PrEP, PrEP. Pre-exposure prophylaxis is just the use of antiviral medication in high-risk populations, especially gay men who are having sex with multiple partners. And I don't mean, of course, to make assumptions, but this is what PrEP was initially, the population that PrEP was initially created for.
Initially, and so I'm learning a little bit about PrEP
Yeah,
as
tell me.
an insurance attorney, and I can tell you more about my current work, but insurance plans are now required to cover PrEP. So that's a good thing for people to know. Talk to your provider, feel free to call your health insurance company or health insurance plan and ask about that. And one thing I asked, and I have not read this, this is something I heard in the workplace, is that actually college students
Yeah.
are using PrEP. That to your point, it initially was thought of as something, and it was very thankfully very helpful to gay men. But I believe, and you and I should confirm that offline, but I believe that it's also now being used by college students, basically anyone who's sexually active, I think.
Yeah, exactly. And in fact, after the show, I think what I'll do is probably try to put a link up in our social media for who is a candidate for PrEP, because it's funny, I'm a gynecologist. My practice is exclusively women, but you'd be shocked how many brothers, nephews, uncles of my patients will reach out to me and say, hey, could you give me a prescription for PrEP? I just want to be responsible. And I mean, maybe they don't have the time or effort or inclination to, or they're ashamed or they're not out, I just don't know, to go to another doctor, but they figure gynecologist, sexual medicine expert, I don't mind prescribing PrEP. But it just makes me so happy that people know about it, and I wish more people did. I think that's a direct to consumer marketing campaign that would be great.
Absolutely. And, you and I are using the terms gay, lesbian, transgender. These labels
Yes.
mean something. They are embraced by certain people. I myself am lesbian. Lately, I kind of identify more as gay. But one thing I learned, especially working in a rural area on HIV/AIDS prevention, and for instance, through federal and state funding, public health funding, we had a men's program, we had case management, we had a prisoners program, doing HIV prevention education across several populations. And one of the things we learned, a long time ago, 20, 30 years ago, is that some people women who may have sex with women, men may have sex with men and not identify as gay. They might identify as straight. They might even be married to someone of the opposite sex, but on the DL, they are having same-sex sex. And so let's just keep that in mind too, as for everyone out there. When we talk about PrEP, when we talk about, quote, high risk populations, we think about people both from a clinical perspective, I'm sure you do, Maria, and also from a public health perspective based on their behaviors, not the labels, right?
That's so tricky, I have to say, though. And I think, what I'm going to say is not going to come as a surprise for you. There's an enormous gap between clinical training in straightforward medicine, pathology, physiology, anatomy, and sociocultural, I guess, wording or terminology. We are, and it's not just me, because I've been out of practice for a long time. Even the young physicians, nurse practitioners, nurses, PAs who are trained, they first of all, one problem is they bring their own background and their own baggage with them. So if they were raised, for example, in a strict Catholic household that sort of taught them that masturbation is a no-no, it's very hard to change that. It's very hard to get them to even accept that they're not a bad person for wanting to talk about masturbation. And I have patients that have been raised with, especially certain religious backgrounds, where homosexuality was considered something illegal, or well, it was illegal in many places for many years, but evil or wrong or morally corrupt. And those people then, if they in turn become clinicians, they bring some of that baggage. So, we could do a whole nother session on terminology and on
Clinical practice.
and clinical practice. I was reading yesterday sort of a conference for nurses on how nurses can overcome their own stigma about the LGBTQ patients that they encounter. And it was case studies where, a woman was waiting for surgery and another woman was holding her hand beforehand. And, the nurse came up and said, well, you'll have to leave now. When her husband gets here, he'll want to come in. And of course she said, I am her partner. I'm her life partner and I have right to be here. And it's just so common. And, I don't, of course, we fault the nurse for not thinking that through, but I would, to defend the nurse a little bit, I think that nurse may have come from a family where this was completely under the radar, not spoken about, not advocated for, and it's frustrating, but it's possible to change. It's absolutely possible.
Yeah, we all make assumptions, and in the clinical setting, those assumptions can have a chilling effect, right? So as a gay person, I talked before this and said we would talk, personally as well. I know that if I've been in a clinical setting sometimes and someone makes an assumption about me and who I'm having, sexual relations with, they mention a boyfriend or something, or they simply don't acknowledge my partner who's right there. Being of my, generation, if you will, a little bit older, I tend to kind of retract into the closet, believe it or not, and get quiet and just let it all pass, sometimes. And I think that's just, again, we can talk about that another time.
As women, we've learned to do that too, right? As
Absolutely.
women,
as gay people, as women, for trans people, I think that's a big deal. This is a very personal relationship between you and the clinician, and you don't, especially once they start making assumptions, it can be scary to come out, because you want to get good care and you're kind of concerned, well, will they think differently of me? So that is a big issue. And then also you and I were just talking about, labels versus behaviors. And so I just wanted to mention, the other thing that comes to mind for me is that I'll call them younger generations, let's say, people, really, I'd say 10 or 15 on to 25, 30, even 35. In many areas, they think differently about labels, right? So younger people
are they more fluid with their labels? Yeah.
Not exactly identifying as gay, not necessarily lesbian. Sometimes even just wondering, why are there even labels? Who cares? It's about the person or who I like. And so there again, if you're not coming out and saying, oh yeah, I'm lesbian, then again, your provider or others can make assumptions that you're just straight.
Yeah. A trend in my practice I've noticed, especially in, I'd say, sort of 12 to 25-year-olds, is to like the label pansexual, because they feel that it allows them some fluidity and some, I don't know, maybe ability to change or ability to go back and forth. I'm not sure, but it's super, super common for a lot of my patients who are maybe questioning or maybe experimenting or maybe just not sure where they're going to land, or don't want to be labeled as one thing, or don't want to have to land on one label, to just say, I'm pansexual. And one woman was really cute. She said, I'm pansexual, but please don't ask me if I'm having sex with a goat. I'm not having sex with any animals. That's not what pan means. I think she was studying Greek mythology or something. And I said, no, don't worry. I don't think that. But she just wanted to be able to have that label because it was nice and broad, which I think is sort of what you and I were talking about before.
Yeah, absolutely. And I have kids, as you know, elementary and middle school age, soon to be middle school and high school age. And I hear that among some of their peers too. And to me, that was a brand new term, even as a gay person who's been out for, 30 years. That was a new term to me as of a year or two ago. But yes, there are young people who are, right. And I think that's in part because of the barriers and the stigma that has been knocked down, taken down by advocates, activists, people advocating for civil rights, if you will, equal rights for gay and lesbian people. And it means that, today for a lot of young people, they don't feel the need to attach themselves to a label or be straight or really, really, really try to be straight, even though they may be having same-sex feelings. They're a little more open than previous generations to the fact that they might be attracted to the same sex, that's not necessarily a death sentence. It's not a terrible thing. It doesn't mean you're sick.
Right.
It doesn't mean you can't have a
Right.
normal life.
You don't need electroconvulsive therapy. You don't need to be
Yeah.
removed from your home or banned from your church or whatever. My trans patients, I would say, in general, have as a healthcare clinician, almost, I want to say, suffered the most, though. If I just think about the absolute like refusal to give care. I have had many trans patients come to me and say, you're the 6th clinician I've gone to. You're the 5th clinician I've gone to. I have been actually turned away from clinics saying, we don't do that. We don't treat that disease. I mean, can you imagine being called a disease? One trans woman came to me and she said that the last OBGYN she had gone to asked her if she had any medical problems. And, I think she mentions thyroid problem or something like that. And he said, anything else? And she said, well, I think you should know I'm a trans woman. And he said, okay, I'll list that as a disease. And she just got up and walked out. She said, I'm trying to be human. I'm just trying to be the version of a human being that I feel I was meant to be. And I'm not a disease, so there's a stat that Olivia's posted for us. Nearly 3 in 10 transgender people reported that clinical providers would not see them, refused to see them because of their gender identity. So I view this as a product of 2 things. One is that providers' own lack of training, which just needs to change at a training level. And 2 is probably the provider's own discomfort with the situation, own inability, not just to know how to treat or counsel, but a generalized discomfort that, again, I hope will diminish as education gets better.
Yeah. So let's make that pivot kind of consciously in this talk. We've been talking more about sexuality and sexual identity,
Right.
and as you know, and so let's just make clear to the audience that we know, there's a difference between sexual orientation, if that's what you want to call it, who you're attracted to and who you want to kind of maybe get in bed with, versus gender identity.
Right.
Which is completely separate. And our topic today is gender identity. So we can stay with that for a little.
Sure. I mean, there's so much to talk about, and we have time, thankfully. Olivia had a great chart that I think she'll put up at some point that, oh gosh, I hope I hope I sent to her, that just sort of breaks it. It's like a flow diagram of sort of your chromosomal birth, and you cannot change your chromosomes. You can change parts of your body. You can change your expression of your gender. You can decide who you sleep with. You can decide who you're attracted to. Chromosomes you can't change. And so it's sort of a wonderful breakdown, and she'll hopefully she'll find that and she'll put that on for us. If not, I can post that on social media after.
What a wonderful and scary and kind of juxtaposed time for transgender rights, transgender issues, right? On the one hand, we see fabulous, strong, super happy transgender people, living life however they want, out in media, in movies, in TV, in real life and regular life. We know that there are more and more providers of gender affirmation services. 5 or 10 years ago, maybe 10 years ago, for kids in particular, there were probably 1 or 2 clinics across the country. And today there are probably 50 or 60 different, specific gender affirmation, I'll just call them clinics. And then in addition to that, of course, you have all the other providers providing care. On the other hand, we have violence against transgender people, killings, targeted hate crimes, and now we have the legal issues. It seems that there is a conservative agenda out there, and that the same entities that were attacking, gay marriage before, the Heritage Foundation, the Family Policy Institute, have pivoted and drafted legislation and are trying to get a lot of states. I think it's probably 10, 20 states at this point that are kind of reviewing this legislation to ban gender affirmation procedures.
Yeah.
You've got the
Yeah.
whole toilet, this whole kind of false issue around trying, even some cities and towns or states trying to legislate which bathroom people can use. We could talk about that for a while too. I think that actually does make some people uncomfortable. I've been surprised
Well,
sometimes at
yeah.
how
Yeah.
uncomfortable that can make people.
Yeah, yeah, me too. And it's like, a bathroom is just a place where humans do what all humans need to do. They need, they take in calories, they process calories, they need to exit, urine and feces. It's just human. It's not a thing. And it's amazing how easily people are uncomfortable about that. It's a shame.
And I think
Um,
that's due in a large part to media. You and I are a similar age, and there was both radio silence about transgender people, even though this is not something new. This has been around for centuries. People who maybe don't feel an affinity for the gender they were assigned at birth. So there was both a silence about that, but then there were also these awful stereotypes. A transgender person in media or in a movie, was like maybe a creepy killer or something, or some strange predator, sexual predator. Same with gay people and gay men. And those stereotypes, we've really just got to fight that, because when we really speak concretely to someone we know and love, maybe a family member or someone else, about this, well, I don't think, a woman who used to be a man should be using the women's bathroom or something. You start to peel it back. Well, what is that fear? What is that about? And it's
what
often
are you afraid of?
outdated stereotypes. Yeah. What's the
I've come to think between Black Lives Matter and all the anti-LGBTQ laws, I almost feel the basic thing is a fear of other, a fear of difference. The same reason white people turn around in an alley when a Black person or another minority is following them, which is, they're not following them. They're just walking in the alley, but they perceive they're being followed. Why? If you walk behind me, I don't perceive you're following me. Why is that? And that is so, there's no logic, but there's some, and anthropologists would say it goes back to when we were, pre-Homo sapiens, when we were slithering on the ground millions of years ago, that survival instinct of fear of other, and that we perceive people with different colored skin as other, and we perceive people with a different, either, I don't know, different gender identity or sexual attraction as other. I mean, I struggle with it because I don't follow that. I don't believe in that.
What comes to mind for me is there's a documentary film called The Celluloid Closet. Maybe Olivia can put a link or something in the chat.
That would be cool. Yeah.
And it shows you, it's by Vito Russo, and it shows you even sometimes just in fast forward, all the movie clips from the time film first came out, in the 20s and then the 30s and then the 40s, what a gay person, how a gay person was portrayed, sad, depressed, suicidal, murderous, stalking. It's just astounding to see how people were portrayed. No wonder my mother, when I came out to her, in college, her first instinct was worry and fear. And oh gosh, she just, even though she was a super liberal, progressive, educated woman, who even had lesbian friends, in her mind from her childhood, she had this idea that maybe I was going to be sucked into this dark, scary, sad life or something. And that, I think that is why some of these stereotypes persist to this day.
Well, I'm kind of guilty of that, like your mom too, in that when people close to me have come out to me, my first instinct was, oh my gosh, there are people in the world that think you don't really deserve to live. And there are people in the world who will, tie you up and drag you behind a truck. And, it's very hard not to let your head go there because you love them and you don't want harm to come to that person. So I think our generation is still, we're reaching back to some horrific crimes. And frankly, I'm not sure we've seen the end of them. I don't feel like all the progress our country has made for gay rights is without some steps backward. Look at the laws, like we said, 300 anti-LGBTQ laws in the past year.
Right.
Right.
Right. So let's talk about that for a moment. So we have this purported leaked draft Supreme Court decision, right, that came out a couple of weeks ago. Some media outlet published it, and supposedly, and most people think it probably is the real deal, it's a draft of the Supreme Court justices overturning Roe v. Wade. And so now we sit here waiting, and I know you've talked about it in this forum, to see, and most people think it would be the end of June, maybe beginning of July, if indeed the Supreme Court is going to overturn Roe v. Wade. And what was shocking and remarkable and in terms of implications of the way that decision was written is that it basically said, Roe v. Wade was wrong, and that this court, there's no reason to stand by and let that decision stand, even though prior courts have even said about Roe and obviously about other decisions, this concept of stare decisis, which means, basically we won't revisit that. It's been decided. Right. And so what happened after Roe said that a woman's right to choose whether or not to carry her child to full term is something that's found in the privacy rights of the U.S. Constitution. And since Roe v. Wade was decided, other cases also rest and rely on that judicial decision. So if Roe v. Wade is overturned, gay people and women and people of color become very concerned, as do all like-minded people, that other rights that have also relied on that same decision could be in question. For instance, the right to contraception, gay marriage, gay sex. Gay sex used to be illegal until 15 years ago?
So important that you distinguish between those two. In other words, you could see where that they would go after that and say that gay sex is now illegal again.
Exactly. Wow. Yeah. So in terms of
is this when they say the term penumbra, right? Penumbra, it's sort of an overarching, help me understand penumbra, that term.
So penumbra means kind of in between, maybe. Shadows may not be the right term, but it's kind of not, so when we talk about the Constitution, it's not written in black and white, but when you read it as a whole, kind of interstitially and in between are a penumbra of other rights, right? So when you read the Constitution and the explicit rights that it gives, and you read things together, you have a penumbra of other rights. And one of those.
If Roe is overturned, the Supreme Court could then use that to say we're allowed to go back and look at things we've passed before and revisit them, right?
Exactly. Exactly.
Yeah, I was marching in Washington, D.C. a few weeks ago, Bands Off Our Bodies march, and some people just had posters that just said penumbra. And so, of course, I had to look it up. And because most of the posters were very witty and very great, and penumbra was so subtle. And
interesting.
It was, a lot of people just saying that they were marching there really because they were saying, if Roe is overturned, this could be a slippery slope.
Exactly.
And we could lose right to gay marriage, right to gay sex, like you say.
What else? Contraception.
Right.
Contraception could be limited.
Right. I've seen a lot of
interracial marriage. I know Loving v. Virginia obviously was pre-Roe, but I believe there are other, other cases.
And I think where there's hate and racism and anti-Semitism and fear of other, or fear of women's rights or gay rights, I think a lot of the same crowd that fears one fears all of it. So it's not crazy to think that would be part of the problem. That would they'd go after that, which is truly like now we're hearkening back to the 1950s. Really, we're just kind of zooming straight back there, and that was also a number of the posters were a number of the marchers were dressed as women of the 1950s with pearls and little goofy hats and dresses, just
Oh,
saying, heading
wow.
right back there. And a
Yeah.
number of 70-year-old women were marching, saying, I marched for this exact same thing 50 years ago. It was
So
really quite.
inspiring and so sad.
Yep. At the same time, I was proud of them for marching, and I was so sad that we all had to be there. It feels very wrong as a woman, but it also feels terribly wrong as a healthcare provider, to deny women access to abortion or contraception. So when we look at some of the laws I had looked into, Alabama, for example, has just passed a law prohibiting gender affirming care.
Mhm, mhm.
Um, what is that about? Florida, the Department of Health has opposed care for transgender youth. So if you are already transgender or you declare yourself transgender, you are now prohibited from the same access to the same health care. Florida doesn't think it's worth spending any money on your health care.
Mhm,
Again,
mhm.
these should be
So
basic healthcare
these
rights. I mean, am I
these
missing
political
something?
issues, this harkens back to me to the early 90s. Again, when I don't know if you remember, you probably don't because
I
you probably
wasn't
weren't
born.
you weren't
I
watching.
wasn't
I was
born.
one of the nerds, the
Yeah.
political nerds, also gay nerd, who was watching. When Pat Robertson at the Republican National Convention went after gays,
What
as a
did he say?
disgust,
Remind me.
dirty,
Yeah,
we will protect our families, these gay people.
right.
And back then there was just
Nita
really
Bryant.
trying to smear gay
Yeah,
people, right? Nina Bryant. And what happens is when attacking certain people and certain issues or people who are seeking certain rights is politically expedient and
yeah,
seems to play on people's fears and kind of galvanize them politically around a party or a candidate, they kind of
yeah,
become the target. And so you see these cycles. And, it feels like it's no accident that just as we were gaining, as transgender people, were gaining access to equality,
yeah,
the ability, more ability to have jobs, less discrimination, access to health care. The Affordable Care Act said that providers and insurers who exclude gender affirming care are committing sex discrimination under federal law, that providers and insurers have to cover the services and providers have to provide the services. Of
yeah,
course, there are certain religious exceptions and whatnot, but just as transgender people were starting to, get some gender affirming care, among other things, there's now this giant backlash and
right.
this and I don't think it's necessarily, when you do polls, right, when you look at the American people, they're, although people can get whipped into a frenzy of fears if you play on their fears, I think this
Yes,
is more coming from the top down. Like I mentioned, the Heritage
I do
Foundation,
too.
the Family Policy Institute writing this legislation, lobbying, helping to get it introduced, and
Yeah.
then political candidates using it to whip up their base.
Constituents, right. Just
Here's
like
that.
most Americans would love some more gun control laws and background checks
Exactly.
and things like that. But we are hamstrung politically. We cannot get any policy changes passed into law because it's not convenient for the reelection of the politicians whose bases you know, may vote differently if they swing too far, so
Right.
it's
And
a
let's myth bust and talk
yeah,
about a little bit about the facts. And I think you are, especially an expert on some of the clinical facts. My sense is that there's some mythology out there especially if you're in a social media algorithm around bashing, transgender people and gay people and trying to play on people's fears. And I don't happen to be in that algorithm, so I don't always know what the scary memes and whatnot are. But they seem to be playing on these ideas that young children might be receiving experimental treatments that they shouldn't be receiving, or that young people
Or being
often
taught
change
in,
their
like,
minds
way
about
too
things.
close, right? We
Yeah.
don't, I mean, I've seen, conservative posts in social media talking about how horrible that an elementary school teacher was gay and trying to brainwash the
Right.
children. And I just, it took a minute for me to even think how that's a thing, and
With the whole
my
don't say gay thing in Florida, like this idea that by saying gay, kids are going to get the idea that they want to be gay. And this is old, by the way. This goes back 40, 50 years, this idea that there's a gay agenda and that
right,
adult gay people are preying on children and trying to convert them
right,
to be gay. And I
right,
once had a meme, it was a sign somebody was holding up that said, it was a big poster and it listed out, it said, here's my gay agenda, wake up, walk the dog, get breakfast for the kids,
yeah,
get dressed for work, go to work,
yeah,
run home from work, take
yeah,
the kids,
yeah,
to their
yeah.
sports or
No
whatever
part
it
of
is.
that agenda
That's
was convert innocent elementary school children to being gay. Like, it again preys on that little twingy fear of the other, in my opinion, that if not very open-minded people are afraid of something that's not them or not what they grew up with, then it's easy, especially for a manipulative media source, to sort of create almost an evil, kind of agenda for
right.
that.
And it just doesn't match up with the facts. If you're
Right.
afraid of, what's the word for it? Pedophilia.
Right.
Pedophiles tend to be straight men.
Oh, yes.
Uh,
Yes.
if you are afraid of, kind of unproven medical experiments, treatments kind of being pushed on children, that is not the fact. The fact is that clinically speaking, clinicians and professional groups of doctors and researchers are able to show that these treatments are effective and can lead to lower rates of suicide,
Right.
and that
Right.
we're not talking about experimental treatments on children. For
No, we're
some
talking about
kids,
gender affirming surgery. We're talking about young men and young women, biological men and biological women, I'm referring to now, who want to be the version of a human being that they feel they are, that they feel they are. Uh, 2 weeks ago, we had such a wonderful episode of Gynecology with a really talented surgeon named Dr. Susanna Nazarian, and one of her lovely, wonderful patients. She's a breast surgeon, so she just does the top surgery, but she was so articulate in saying that it is so gratifying to her to enable human beings to get to be the human beings they want to be. She doesn't see it as a political issue. She doesn't see it as a sex issue. She sees it as a human issue, that these people come to her and say, this is who I look in the mirror and see. Can you help me?
mm-hmm.
And it was so poignant. And so to morph that into some weird, creepy, abusive, um, you know, um, desire on the part of children, I guess.
Right. I believe the state of Texas is calling it child abuse.
Right.
And that's terrifying for a parent, that when
Yeah.
you take your child to a clinic to see doctors who are basing their treatments on years of research and, clinically sound practices, and doing, it's like you said, there aren't sex change operations being done on children. That's not medically
Right.
advisable. That's
Right.
not what's happening. It's things like puberty blockers that put a pause on the hormones that start surging in
Puberty.
pubescence,
Right.
puberty.
Right. And these are not, I'm not saying everything's reversible or anything like that, but I'm saying these are not destructive, like you said, surgeries. Most of my trans patients are very thoughtful, very methodical, very cautious about what they're doing. They don't rush into anything. They go to centers where they are mandated to have psychological counseling to make sure this is really what they want, and not a whim or an idea from a bad breakup or something like that. And at least the trans patients that I am lucky enough to know are so grateful and
Mhm.
so happy. And
Mhm.
the comorbidity of depression and of suicide is so high in that group. So as you mentioned, to be able to reverse that, to be able to accomplish some mental health progress in the United States is a win. Um,
Mhm.
and yes, there's cost to it, but you know what? There's cost to suicide. There's cost to treating depression. Um,
Mhm.
so I think I'm a big believer in spending the money so that you can have the happiest and healthiest patients and Americans that we can have.
Mhm. Yeah, it seems like the numbers are growing. The numbers of children who identify as either being somewhere else on the gender spectrum, not necessarily being completely binary, male as they were assigned at birth or female as they were
Mhm,
assigned at birth. So
mhm,
typically,
mhm.
transgender, maybe non-binary, seems to be growing. One estimate recently was that there are 300,000 children who identify this way. That was a study out of UCLA. So then there's also talk about, well, why are the numbers growing? And it
Maybe they
seems,
feel more comfortable. Maybe they feel more comfortable, which is just wonderful. I mean, but I think it also harkens back to earlier in our conversation, the trend, I think the welcome trend that um, that LGBTQ youth do not have to feel they have to pick one of those letters and be that.
Mhm.
Well, I am attracted to girls, so I am a lesbian. Maybe I am, but maybe I'm also attracted to men.
Mhm.
Maybe I'm attracted to one or the other, but I see myself when I look in the mirror, and I see myself as a man, even though I'm chromosomally female or vice versa. And that's a lot of the trans patients that I'm lucky enough to have as patients, where they don't necessarily want a neo vagina or a neo
Mhm.
phallus, but they really would love to not have periods, for example.
Mhm. Mhm.
Um,
And
and
I think too, for the person who's on that gender spectrum and seeking out and interested, in a valid way, like you said, with counseling, with a
yeah,
lot of thought, feeling like they might want some gender affirmation care somewhere on that spectrum, it's generally because not getting it is causing deep pain and
yes,
frankly psychological, emotional, and other issues. the
right.
the fact that in the past and even currently, sadly, in a lot of places in our culture and across the world, transgender people aren't able to come out or aren't able to talk to someone or aren't able to receive that care, it's extremely painful. And I know Olivia put in the chat, you see higher rates of suicide. You just see people who aren't able
Yeah,
to be fully themselves.
comorbidities,
And don't we want people to be fully themselves? What's so
right, then they can
scary about someone making a personal, choice?
statement, right.
Yeah.
And by the way, then they're not, depressed in their room, they're out getting a job, advocating for others, being a part of their community. And I think so I have a lot of trans men patients, and they are chromosomally women who very
Mhm.
much want to have a male pattern of hair, want to take testosterone
Mhm.
for that, and want to not have periods. And I can't imagine identifying as male, looking in the mirror and feeling that every fiber of my body was male and having a period every month. What a
Mhm.
rotten thing to have a
Mhm.
monthly reminder that you
Mhm.
have failed at how you identify yourself. And I can't tell you how many of these patients come to me saying, my OBGYN refused because he or she said, nope, you have to have a period. That's just what normal women do. And they don't
Mhm.
even hear that by using those two words, normal women, read between the lines. They're implying
Mhm.
that that patient is not a normal woman. And just the whole word normal is so wrong. It's so damning, to say that as a clinician to a patient, that what
Mhm.
you're asking is not normal. Um, Periods, oh, by the way, are not necessary. I mean, this is a huge shock to most women. They say, "No, no, my mother and grandmother told me it's how you clean yourself. Your body cleans
Wow.
itself every month." It's enormous in the Indian and Pakistani communities that
Mhm.
the period is a form of cleansing. There
Mhm.
is nothing cleansing about it. If you want to clean yourself, take a shower, blow your nose, do
Mhm.
something else.
Mhm.
Period is simply throwing away blood and cells that have formed a lining of the uterus, which makes this little snuggly duvet waiting for a fertilized egg and sperms, aka embryo, to come and
Mhm.
implant. It's just a little cute, cuddly bed. And when a human being doesn't achieve fertilization, the body says, "Oh, we made the duvet for nothing. Toss it."
Mhm. Mhm.
Very good at recycling our bodies, our female bodies. So we throw out the blood that we don't need to throw out. It makes some women anemic. We throw out cells that we don't
Mhm.
need to. So forms of contraception or other treatments that we can do that stop periods totally give trans patients so much affirmation, and they
Mhm.
take away that monthly reminder plus pain and bleeding. So if you're one of those people that wishes you didn't have a period but you think you have to because someone told you it's healthy, you really don't. You can get on birth control pills, you could get an IUD, you could have something called an endometrial ablation where we warm the inside cavity of the uterus, and this stops periods. I mean, you could have a hysterectomy if you wanted to. But again, many patients are denied this because doctors say that's too radical, and you don't need to do it because they're imposing their own feelings on
Mhm.
the relative importance of this to trans patients. So I
Yeah,
chat.
so the essential, I think there are probably many, I'll call them medical professional societies out there that probably include some of this clinical guidance and information, but let's not forget to mention WPATH, and maybe Olivia can put that in the chat. I'm blanking right now on what that stands for, World something Transgender Health. WPATH is about 3,000, mostly clinicians, MDs, who review all the research, who have their
Mhm.
own clinical experience, and who for many, many years now have come out with, I'm a non-clinician, but I'll just call it like the, seminal, the Bible, if you will,
Yeah, yeah,
guidance on transgender care. What makes sense for prepubescent kids? What is
right.
clinically appropriate for adolescents? What is best for a variety of different situations, maybe even including the things that you just talked about. And
Right.
WPATH is actually coming out this summer, I believe, with some new, they update it
Guidelines.
every now and
Mhm.
then, and it's
Exactly.
getting updated.
Yeah, and I think it's important. I think how amazing would it be if primary care physicians all knew WPATH? They don't have to be experts on transgender care, but they could at least reference that. And physicians are so frightened to be caught not knowing things. Maybe because I don't know. I don't want to say because we live in a litigious society, but maybe it's our training. But we're always afraid to not know something. And I found the more years I'm in practice, the more I'm comfortable saying to a patient, I don't know the answer to that, but I'll get it for you. So
Mhm.
WPATH would be a wonderful resource for clinicians to have,
Mhm.
to look up answers or to refer their patients to.
Yeah, and I believe the Institute of Medicine, going back, because like I started doing public health work 30 years ago. Going back
Mhm.
30 years, I know they both did research and provided guidelines on things like best practices to make sure that gay and lesbian people, men who have sex with men, women who have sex with women, feel comfortable in your practice. And so the Institute of Medicine may also be another
Yeah.
place to get information.
Yeah, I mean, I have the most insignificant little rainbow flag at my check-in desk, and I cannot tell you how many people have commented on
Yes.
that silly little flag. that took
It
3
means so
seconds.
much to me when I see that. And I spoke recently at work. I guess maybe it was actually last year on a panel about being out in the workplace, I think. And I mentioned that, I actually, when I first joined my company many years ago, I wasn't sure whether I could be out. And so it's just so easy not to be out, right? People say,
Yeah,
what'd you do this weekend? And I say, oh, we took the dog to the park. Oh, we, went to
right.
see my family. I in my department, I was okay being out. I knew it was fine, but I just felt like with other people, I was just meeting. I didn't want them, I didn't know. I didn't want them to just have some issue or even just subconsciously. And one thing my company did is a lot of companies have employee resource groups. And so about 10 years ago, my company launched these employee resource groups. So they're kind of affinity groups. So there's one for gay and lesbian, women, people of color, Black Professionals Network, Azu Latino. There's a South Asian or an Asian group. Just having the gay and lesbian group at work made a huge difference. And the other thing was pronouns. Seeing people put their pronouns, she, hers, he, him, they, them, in their signature block on an email, to your point, a little rainbow flag, maybe it's just in a coffee cup pencil holder on your desk, or maybe it's, if you're in an elementary school, maybe it's on the classroom door, something makes a huge difference because we are invisible. We gay, lesbian, transgender people are so invisible in this world, and straight life, straight images are coming at us constantly. All of my favorite TV shows and movies and books and the magazines, the advertisements, until recently things are changing, but generally speaking, I just didn't see myself anywhere. And you start to believe that other people may also just not be familiar with what it means. Yeah.
Not
Your
see
point.
you.
Oh, other, right? If I don't know what this is. And so it's so important. We have coming out day every October. If you feel safe coming out, take that extra step, maybe come out to a family member or a friend or your parents, again, if you feel safe. And then
what advice do you have for someone who's not out to their parents yet, doesn't feel unsafe, but doesn't feel like it's going to be an easy conversation? I mean, your mom's was super open and liberal, as you said, but my son told me many of his gay friends at college literally have been ostracized from their families once they came out. I mean, even today.
Wow.
Yeah.
Wow.
So how do you make that jump?
Well, look, first of all, let's just say it's real. It's a big issue. When you look at homeless youth, great proportions of homeless youth who are on the streets needing shelter or sleeping on, the generosity of friends' couches or other families' couches have been cast out of their homes because they are gay or trans. It's a real problem. It's a real issue. And, so the coming out process is a process, and there are organizations to help, and there are organizations that can also just help you not feel so alone. There's the Trevor Project, there's the Human Rights Campaign, there's
my husband's involved in the Trevor Project. Trevor was a young man who committed suicide.
Parents and friends of lesbians and gays. And it is a very personal issue. And, first of all, it is okay not to be out in certain circles if it's not safe. If you've got a job and you just know at that job that you're passing as straight or you're passing as a certain gender, you shouldn't feel pressure to come out. But if you can start to develop some allies among people who you feel safe with and get some practice with coming out, it's really, really scary at first. And generally, I think a lot of people will be surprised. You tell a friend, you tell a family member, and they either say, oh yeah, I knew, or wow, how can I help you, best case scenario? And maybe you can share some resources with them. And the other thing is sometimes a parent especially might have a shocked, disappointed, this is just a phase, you've always been rebellious.
Are you sure?
Are you sure? Yeah. But parents too often will come around.
Sure.
But it is sad that not everybody does, and that is a fact.
Yeah, Olivia had just put up there that up to 40% of homeless youth identify as LGBTQ. Up to
That's
40%.
astounding when you
So
think about
that's
what percent of the
that's
population they make up.
yeah. What percent would you guess? Do you have a guess that are
Well, we've
LGBT?
always used 10%,
I
right?
know
And I don't know where
that's
that comes from, and I don't know if that's grown or changed.
yeah. That is worth looking. I will look into that.
Mhm,
That would be
mhm,
really interesting to see if that's grown or changed
yeah.
or where that 10% comes from. Because I've heard that 10% since I was a teenager, you know,
Yeah,
years
me
ago.
too, me too.
Yeah, but you're right about safety. I guess in 2007, when my husband and children and I left Europe, my husband and kids came to America, and I went to take a trip with my best friend, who is an art historian. And he is gay, and he wanted so much to see some of the art in Russia. So we'd planned to go to Russia. And just before we got there, marches and kind of rioting broke out in Moscow, in anti-gay rights, I guess you'd call it, and
Mhm, mhm.
gays were being sort of pulled into alleyways and beaten. I mean, it reminded me of sort of 1960s Mississippi, just horrible,
Mm,
violent crimes. And I
mm,
said, let's go. They will have no idea you're gay. And he said, there's no way I could go knowing that's
mhm,
happening.
mhm,
And of course I understood. And we went somewhere else. But this was in 2007. This was
mhm.
not, 40 years ago.
Well, there are still parts of the world where it is not safe to be. It's more than not safe. Like it's
Mm.
really violently unsafe. Which which raises another issue today in the U.S. and elsewhere. People who do have resources, who maybe do travel for pleasure, or whatever. Think about where you're spending your money. We talked a little bit about what's going on in the United States with different states passing laws that are very regressive and harmful to transgender people, um, transgender kids, gay and lesbian people. Is that where you want to spend your vacation money this year? Or
Do you have in your head, off the top of your head, sort of the top three and the bottom three in terms of
well,
gay?
I'm very concerned about Florida and this "don't say gay" issue. I mean, that just
Right.
seems
And
so
Greg Abbott
mean.
in Texas. Greg Abbott in
Yes, in
Texas
Texas.
just saying, I just read it earlier this week. Texas Governor Greg Abbott and Attorney General Ken Paxton issued a letter and opinion with a dangerous and false suggestion that gender affirming care for transgender youth should be considered child abuse, which is what you
Mhm,
mentioned. That's
exactly.
we're just it's whispered down the lane, and now I don't understand the sentence really.
Exactly. And I heard a radio interview with a mom in Texas who just was beside herself, and she just
Yeah.
said, "We've been working so hard for my child to understand." I don't remember how he or she identified, but to understand them and to understand what they need. And we got to the clinic and we were getting the care that they need. And they're just starting to blossom and starting to come out of their shell and starting to feel like themselves and do better at school. And now we're thinking of leaving Texas because I could be accused of child abuse. My child could be taken away from me.
Yeah.
And it's not like this is a person of means who can just pick up, get another
Yeah.
job. So
Well, again, it will disproportionately affect those with means and those who
Mhm.
don't. I mean, the number one reason women have unplanned pregnancies in New Jersey is not carelessness, it's lack of funds to get to a clinic to get birth
Right.
control. So,
Right.
you know, when you pass laws that restrict access, you're going to disproportionately affect
Mhm.
the lower socioeconomic rungs of your population ladder. No
Mhm.
question. So yeah, there is actually, I see route50.com, public safety, best and worst states for LGBTQ people. I
Mhm.
was actually curious almost internationally too. I would almost imagine
Mhm.
Scandinavia, the Netherlands, um, as sort of some of the more progressive states for
Mhm.
LGBTQ youth.
Mhm.
New Zealand as well, I think. And I don't know. I'm guessing the Middle East would be worst. I don't know.
Yeah.
That makes sense, right? Don't you
Yeah.
think? So, anyway, I guess I'm not planning to go to Saudi Arabia anyway, so I'll be all right
Yeah.
there. But
Yeah.
listen, we should wrap this up. Thank you
Okay.
so much for joining me. I feel like we could talk another 2 hours because
I do
there's
too.
so many lenses that we can look through this, so many different perspectives, from youth to geriatric care,
Mhm.
end of life care. I've had patients who legally were denied things that were in a will because the families fought them because they didn't feel that a gay partner should have the right to inherit something. I kid you not. I mean, I had a
Mhm.
patient who
Mhm.
passed, and the family fought her long-term life partner for
Mhm.
that. And they, they got married right before she died, and the family said that didn't count. And,
Mm.
it just our society has a ways to go,
It does. We do. That is absolutely true. So thank you for marching. Marching is so important. Again,
Well,
if people can,
voting's more important. So let's
voting
make
is
sure
so
everybody
important.
votes. Mhm.
Everyone get out to vote.
Yeah. And thank you,
Absolutely.
Osiris, for just doing what you do, for advocating for women, for advocating for the gay community, for helping us with terminology and the legal aspects
Mhm.
of what's going on. And keep up the good fight. We'll see everyone next Thursday on Gynecology, where we'll be talking with people from a really neat local organization called High Tops. Not my favorite name, but because it doesn't really tell you what they do. And they do so much to advocate for teens, for sex education, for LGBTQ rights in our community. And I've been involved with High Tops now for 15 years, which is kind of dating me, I guess, but they're
Mhm.
really neat, and they'll talk with us next week. And I thank you all for watching and look forward to more good topics. Io, look forward to seeing you again. Take
You
care.
too. Thanks for having me. Happy Gay Pride Month, everybody.
Happy Gay
Bye.
Pride Month. Bye bye.